An upper respiratory infection follows invasion of the upper respiratory organ by microbes. The upper respiratory organ include the nose, sinuses, and the throat. A common cold which is caused by virus is an example of upper respiratory infection. It is one of the most ordinary illness found in the people. Symptoms include elevated temperature, that is fever, running nose, and watery eyes. Type of upper respiratory infection include the common cold, that is head cold, the mild flu, tonsillitis, laryngitis, and sinus infection. Of the upper respiratory infection symptoms, the most common is cough. Lung infection may also lead to stuffy or a runny nose, a sore throat, sneezing, achy muscle, and headache. The most common cause of the upper respiratory infection is the most common virus, that is the rhinovirus. Other viruses include the influenza virus, adenovirus, enterovirus, and respiratory syncytial virus. Bacteria may cause roughly around 50% of the sudden onset pharyngitis presentation. How do you know if it is a bacterial virus, bacterial infection, or a viral infection? Common viral infections such as the upper respiratory infection can typically be detected by a running nose, cough, low-grade fever, sore throat, and difficulty sleeping. No antibiotic or antiviral medication can hasten the recovery from the cold. And of note, when they compared to adults, upper respiratory infection to children may last up to 14 days and occur most frequently, average around 6 to 8 per year. The influenza is a viral illness that can cause many of the same symptoms, and but also a frequently accompanied by intense body aches and higher fever. Bacterial infection may be of the result of secondary infection, meaning that the virus initiated the process, but the bacteria followed. When the symptoms persist longer than the expected 14 to 10 to 14 days, a virus tend to last. The fever is higher than one might typically expect from a virus, and fever get worse every day and into the illness rather than improving. These are the uh, bacterial infection causes. This usually self-limiting disease best treated by use of drug to reduce fever, such as the acetaminophen. Rest, increased fluid intake. Patient with respiratory infection should be taught to cover the nose and mouth with a tissue when coughing to, or sneezing. Dispose of the soiled tissues by placing them in a plastic or paper bag or to be burned. Uh, Turn the patient face away from others when the coughing or sneezing. Wash hand after handling soiled tissues. So the patient is having running nose, watery eyes. So do you feel any headache or any sore throat? Okay, so let's check your temperature. So I'm using an glass thermometer for an oral temperature. So let's see. Okay, so open your mouth. Now hold it for 2 minutes. So do you feel any more symptoms like tiredness and so let me check it. So the patient is having an 104-degree Fahrenheit temperature or 38 degrees Celsius, which is indicate the fever. So what I'm going to give you is some take the intake of the fluids. So I'm putting it right here on your desk. So take it and so after this, notify the nurse about the symptoms and so how are you feeling, ma'am? Do you have difficulty in breathing? Okay, so the patient, in this case, when the patient is having difficulty in breathing, it shows the case of upper respiratory infection, which is dyspnea. So notify the nurse immediately after that. You must take special note and report the following: dyspnea, that is difficulty breathing, changes in the rate and rhythm of respiration of the patient, presence and character like color and amount of respiratory secretion, cough, changes in the skin color such as the pallor or sinuses. Upper respiratory infections sometimes move down into the chest and develop into bronchitis or even pneumonia.